Hey guys, it's Camden Griffin. Today we're going to be talking about discussion three, the EMS response communications chain of events. Um, so initially starts as the bystander recognizing the emergency and contacting or calling 911. And that starts the activation of the EMS system. So bystander calls 911, and this is when the EMS system begins. Um, then the dispatcher receives a call and starts to gather info about the call, um, about the patient, about information about the patient. If the bystander knows anybody knows the patient, where the bystander is. The bystander doesn't isn't familiar with the area and doesn't know where they are. So because of the technology and the area of the local 911 system, the dispatcher is able to use an advanced 911 system and find the caller's location. So after that happens, the dispatcher then finds the location and sends for ALS units and police units. Um, that's that part. Moving on, EMS arrives on scene, and they start their interventions. The paramedics start treating the patient, and after the paramedics start their treatment, they have completed all of their interventions. The paramedics then pick up the patient and start transporting the patient to the hospital. After they do that, they then communicate with the receiving hospital to let them know that they are going to be arriving. That's another part of the communication system. And they en route to the hospital, they're obviously continuing to treat the patient. So they do that, and then they arrive at the hospital, drop off the patient, document that they transferred patient care and everything, and then they restock, clean the unit, and go back in service. And that's the flow of the EMS communication system. It all begins with the caller calling 911, and then all the way to the end whenever EMS drops off the patient to the hospital, transfers care, and then goes back into service. Question two: why was the local 911 system of great importance? I think it was of great importance because the dispatcher was, not the dispatcher, the caller was unfamiliar with the area, and so the dispatcher was able to use an advanced 911 system and determine where the dispatcher or the caller is. And this due to that fact, the EMS was able to be dispatched pretty quickly and arrive on scene and do all their interventions. So it's really important to have systems like that in place, because not everybody's going to be familiar with the area. That's just the way it is. So yeah. Question three: what tasks did the dispatcher perform? The dispatcher performed all of the beginnings of the EMS communication system. So receiving the call, and after receiving a call, gathering information about the patient, location, incident details, and then all the way to dispatching out EMS and police units to the scene. They also are going to keep a log. They're going to keep a log of everything that's going on scene, all the way to patient care transfer. Question four: what information should the paramedics convey to the ER physician? Paramedics need to convey obviously patient status, vitals, mental status, orientation, how they were found, who found them, is there any trauma? Did they fall down, hit their head? Are they conscious, unconscious, AVPU? Their assessment data, their treatments provided, what they did. Obviously, if they gave dextrose, the physician needs to know that for their treatment, and obviously like the before and after. So like before they gave dextrose, how the patient was doing, then after they gave dextrose. Also, the receiving hospital needs to know ETA, like how many patients are they going to need additional resources on arrival. Those are just some important communication things that need to be relayed for this. Number 5, why is a written pre-hospital care report important in this case? It's always going to be important in every time, because you need to keep a legal medical record of all the calls that are responded to, and anytime a patient is treated or transported, it's important to have that. And it also for billing and reimbursement and insurance and all the things that go into that. It's also another one would be protecting the EMS provider. So the emergency, if the patient's unconscious, and you get on scene and it's implied consent that you're going to be treating this patient, you need to document all of those things. That way you're protecting yourself to the best of your ability. That's that.